All right. So tell me a little bit about what's bringing you in today.
Well, Dr. Sarah, my lower back has been hurting on the right side, and I've been getting shooting pains going down my leg. And I think it's because I've been inactive for a few days because I've been feeling dizzy.
Okay.
Do you remember back in November when you helped me with that?
Yeah.
It really did relieve it, but I've been getting the vertigo again.
Okay, great. So I'm going to tell you a little bit about Activator, just because I know you know because you've been with me for a while, but Activator is really great for this. She tends to, Tian here, she tends to prefer Activator versus the manual adjusting. The popping and the clicking doesn't really work so well for her, so I use this technique. So as I go through the technique, I'm going to kind of talk about what I'm doing and what I'm looking for, and then we're going to do the ear pull like we did the last time. That really helped with your vertigo. You had that back in November, so it's been 5-6 months
Right.
since you've been experiencing it. So
It's
perfect.
been a while.
Okay.
And then maybe we can check my jaw too.
The jaw. Yeah, absolutely.
And I don't know if the clenching has anything to do with the swollen gland
Sure.
or whether it's, I just don't know
Okay.
what's happening.
Yeah, so we'll check jaw, we'll check low back, and kind of see what's going on. So go ahead and go face down.
Thank you. Should I take off my shoes?
Nope, you can leave those ones on.
Okay.
So as I do this technique, I kind of check leg lengths, and this gives me a good idea which side of the body things are happening on and where the actual problem is coming from. So I do a series of muscle tests that give me a good idea of how to start. Now you're opposite today of what you're usually at with your leg lengths, which is interesting. Okay. I'm going to come up here, test here first, and then I'm going to test up here. This is all testing this low back pelvis area. Come here. Okay. Then I'll make those adjustments. So with Activator, I have different settings for this device, and I come in to all those specific points that I just tested to get pelvis where I want it to be, so those symptoms quit going down the leg. I'm also going to come to sacrum here and do the same thing. How have your hips been?
They've been fine, but the right side started hurting again.
Okay.
And like I said, I really believe it's from laying around just trying to get the vertigo to go away.
Gotcha. Okay. So both of your hips are out. Let's check here. In a few different directions, actually. Both sides have the same thing going on. Put this arm on your low back for me. So this tests that lower back, the lumbar area. Put this one up as well. And drop this one down. Drop that one down. So these adjustments are really great for people that have neurological issues and other kinds of things going on as well, where they cannot tolerate that manual adjustment. Put this arm above your head. Put this one up as well. Drop those down. I'll have you turn your head this way. Lift this shoulder toward the ceiling, drop it down. Shrug those shoulders to your ears and relax. Shrug them up and roll them back. Press this elbow into your side. Press this one in and put your head back to center. All right. Go ahead and look forward for me. So lift your head up, drop it down. Tuck your chin to your chest and relax. And press your face into the table. I also do a series of taps to kind of help the person know which side I want them to turn. So this is really helpful when giving them directions on what to do. Let's go ahead and test jaw now. So open your mouth wide. You definitely have some stuff happening on this right side. Clench your teeth. Take your tongue to the roof of your mouth. Slide your bottom jaw this way. That way. And forward. Okay, turn your head this way for me. So as you can see, this is a very gentle adjustment. And then turn your head this way. And go face down again.
Yeah, the adjustments feel nice.
Yeah. And let's see. Do you want to do a little vibration today on that low back area where it's kind of going down the leg?
Yes. How is my neck?
So your neck didn't actually have anything pop up. I can check a few extra things though. A lot of it was in your jaw. But let me check a few other things. Look down into the shoulder for me. And back to center. Oh, looky there.
Ah.
Right side, look up into the corner of this room.
To my right?
Over here, yep, and back down. Okay. On this right side, you do have a little sneaky guy. You're C3. But surprisingly, normally you have a lot going on in here. Surprisingly, you don't have a lot. You've got a little bit on your right side of your jaw, a little bit on the left side of your jaw, and then that upper neck area. So let me do some vibration down here. Now, not everybody can tolerate vibration that does activator technique, but Deanne, we've already found out, can do that. She does well with the vibration. Just helps all our muscles relax. And go ahead and sit up for me. I'm gonna have you face that direction. Yep, perfect. Now I'm gonna come here and check. So this is where the vertigo part comes into play. I do these ear pulls to kind of allow that fluid to get off of the ears. A lot of times vertigo can be caused from inner ear issues. Deanne said she's already seen a ear, nose, and throat specialist about this. And the last time we did the ear pulling, it kind of helped move some of that fluid out of this area and down, move it out and down. Oh, there it was. And then usually I'll just do a little bit of compression here to allow some of that fluid to come down and get out.
And I can feel it draining when you do that.
Yeah.
Right in the lymph nodes.
Absolutely. All right. Anything else you want me to check?
I don't think so.
Perfect. You're all set.
Thank you so much.
You're welcome.